was born and raised in Houston. I pretty much have stayed close to home. I went to college here as well as dental school, so go Longhorns. I practice here at Spring Oaks Dental as a general dentist. I do focus on airway dentistry as well as restorative dentistry with our pediatric patients. Outside of dentistry, I dabble a little bit in 3D printing. I dabble with the big Lego sets. My husband and I travel a lot. Recently, I've become a new mom. I have a baby boy who's 4 months old, so parenthood has been quite the journey, but it's really been pushing me into this new sphere of treating kids. So working with kids kind of always has come naturally to me. I coached golf, ice skating when I was in college. I was even in a nanny service. I think it's been fun to relate with children, and that's translated to how I practice dentistry now. I don't mind being the silly dentist just because I can have fun with kids but also make them feel comfortable in a setting that can be somewhat anxiety producing. Things to look for is your child grinding, snoring? Mouth breathing is a big one that I get commonly from patients. The other thing is looking at academic performance. It could be as subtle as a child that's struggling in school, but it's just because they're not sleeping well, because they're not breathing well. In our practice, we do try to hone in on early identification of these signs and symptoms. If your child is struggling, we can come up with a customized and tailored plan to make sure that they have the best foundation possible for breathing well so that they can function at their best. It usually begins, honestly, with a conversation with parents. We talk about kind of their struggles. Parents will come to me with concerns first, and then I try to put the puzzle pieces together on this is why this is happening. This is why your child may be struggling in this area. So once we've kind of pieced through the personal concerns, then we do a hands-on exam. Of course, I'll look at jaws, growth and development, look at where the tongue is posturing. Are we having concerns with oral restrictions? Once we've kind of gotten the big picture, then we can come up with a plan of attack of how we're going to get this child to breathe better and sleep better. We have different options. Usually we can try to approach with a removable option, so it kind of helps a child get used to functioning better. They're not used to this. Is something new for them, right? So we have a removable appliance we can use that focuses on growth and development. It also focuses more on habit correction. We're trying to get that tongue in the right spot. That's how we'll get more improvement in their development. We have fixed options as well. We can do fixed expanders. That's really our workhorse to try to get more expansion focus. We also can do clear aligners now. That's a new development, especially for kids that are losing teeth or getting new teeth. It is a great transitional option too. Addressing it early can have a huge impact on a child's overall health. If we catch these things now, we're setting up adults for their best success. If we don't treat these things that we see now that are concerning, they only lead to bigger concerns in the future. This plays out in chronic conditions like heart problems, hyperactivity, stress disorders. There's many things that airway health has been linked to that we're still constantly learning about. By catching it early, we can try to avoid more intensive treatments later on. We're not just straightening teeth. We are building healthy, thriving kids who can function at their best. And I think being a new mom and a provider, there's really nothing more rewarding than that.